Welcome back to the Humble Builder or Healer podcast with Dr. Quang Lei. Thanks for tuning in. I hope you've had a good week and staying warm. Today, I'll talk about what we call one pill kill. So these are very commonly prescribed medications and also over-the-counter medications and some of the household products, even though we use them every day and they are very widely prevalent, but they can be very dangerous if ingested by children, especially younger children, in some can also cause a toxic effect in adults. So I want to make sure that we are aware of the potential deadly effects of these medications and keep them safe in an out-of-reach area in child-proof containers. So first, I would like to talk about what we call opioid toxidrome, most commonly caused by the opioid medications. So the opioid toxidrome include the brain effect on neurological, decreased mental status, from sedation to coma, and sometimes seizures. And respiratory is breathing with shallow breathing and slow respirations, even no breathing. Ocular, related to the eyes, meiosis, pinpoint pupils, but also dilated pupils can occur with low oxygen level and also specific agents like meperidine, which is the opiate, rarely used anymore. And then cardiovascular, more importantly, the cardiovascular collapse, like slow heart rate and also very low blood pressure, which can be very dangerous also. So another toxidrome is anticholinergic, another common one. And anticholinergic toxidrome can also be caused by a lot of medications, and it can lead to low blood pressure, a condition called metabolic acidosis, where there are massive disturbance in the electrolytes and also can affect toxic kidney effects and also toxic heart conduction, leading to irregular heartbeat or heart rhythm, and again, central nervous system depression causing coma or seizures or sedation, and also dangerous arrhythmia like torsades. So also very dangerous toxidrome and very common. So the first class that I want to talk about is the group called alpha-2 agonists, and very commonly prescribed. For example, yesterday I prescribed this medication called Clonidine, which can be very helpful to help patients sleep better and also reduce anxiety, but can cause dangerous low blood pressure and also opioid toxidromes. And this class of medication, the alpha-2 agonist, can cause this opioid toxidrome. And then another common medication over the counter is Nafcon or Naphazoline, and also oxymetazoline spray called Afrin, which everybody is aware of or know about this medication, and also Visine, also extremely common eye drops. So these can also, once ingested, especially by children, can cause the opioid toxidromes. So please keep them out of reach. And then the second group of medication is called a diabetic group of medication called sulfonylureas. Now at the end of this podcast, I will put up a list, and you can pause and take a picture of that list, including the number for the Poison Control Center, and they are especially very helpful. So for diabetic medication group, Glyburide, Glipizide, glimpiride, they can lower blood sugar to a very dangerous level, creating mainly the central nervous system toxic effects, which is anorexia, where you don't eat, weakness, lethargy, seizure, coma, headache, confusion, irritability. And then blood pressure medication, extremely common. Calcium channel blockers such as Nifedipine and Verapamil are the worst in this group and can cause high blood sugar but cardiovascular collapse with low heart rate and low blood pressure. And also another group of blood pressure medications very common called beta blockers, including Metoprolol, Labetalol, can cause very low heart rate and low blood pressure, but also low sugar, seizure, heart block, or abnormal heart rhythm. And the older group of antidepressants called tricyclics, such as Amitriptyline, Nortriptyline, These can cause anticholinergic syndrome, as anticholinergic shock syndrome, as we talked above. And obviously, opiates or opioids such as codeine, methadone, oxycodone, hydrocodone can cause respiratory collapse and death, overdose. And methadone can last up to 36 hours. So if you take methadone 12 hours later, lose the effect, it's still in the system. So if you take something like oxycodone, it can cause overdose because it has that additive respiratory depressing effect on your respiration or respiratory system. So methadone is tricky that way. Anti-diarrhea, very common, Immodium. I use brand names. I'm not supposed to in medicine, but for the public, I will use brand names because it does improve recognition with these medications, and it's easier for people to remember. So Immodium and Lomotil, these can cause first anticholinergic syndrome, shock syndrome, and then opioid shock syndrome. So Immodium and Lomotil. And then another common group is salicylates or bismuth or Pepto Bismol. These can cause nausea, vomiting, diffuse sweating, hyperthermia, where you're very overheated, CNS depression like sedation, coma, seizures, lethargy, and also pulmonary edema, where there's too much fluid in your lungs, cerebral edema, too much fluid in your brain, which is even worse, coma. And then a group of mental health medication, antipsychotics, geodon, chlorpromazine can cause seizure, anticholinergic shock syndrome, and also arrhythmia and low blood pressure. Something we use for itch, the Camphor, anesthetic and itch medication, cooling gel, if ingested, can cause respiratory suppression, seizure, and CNS hyperactivity such as agitation and then depression. Common ward treatment like Podophyllin and Podofilox can cause mental status changes, confusion, coma, delirium, hallucinations. And then a cough medication commonly prescribed, probably one of the most commonly prescribed medication is called benzonatate or Tessalon, more commonly known. Tessalon look like a fish oil, so that's even more make it more dangerous because we don't see fish oil as dangerous. So just ingesting 1 or 2 capsules or chewed by toddlers, which does increase the toxic effects, can cause significant poisoning or death. And so that's why it's only approved for those 10 years or older from these cough suppressant. Tessalon. And then gout medication, colchicine, very dangerous, can cause central nervous system, a mental status effect such as confusion, coma, delirium, hallucination, and also affect the blood system. Very dangerous medication here. We talk about anti-scabies medication called Lindane, can also cause toxic mental status, CNS, brain effects, seizures, somnolence, where you're just very lethargic and affect your respiratory effort, nausea and vomiting. And all the blood thinners can have bleeding risk, and anti-seizure medication also very dangerous at high level. Household products, very important, can cause, look at the chemicals and then report to poison control, can cause drooling, respiratory distress, and cyanide toxicity. So in summary, let me put up the medication list here. So please keep in mind there. Let's see here. This, I apologize, it doesn't work. So I will try to include this in the show note for YouTube. And so the list include Clonidine, Visine, Naphazoline eye drops, Glyburide, Glipizide, glimpiride, Nifedipine, Verapamil, Metoprolol, Labetalol, Amitriptyline, Nortriptyline, Immodium, Lomotil, Pepto Bismol, Camphor anti-itch or cooling gel, Podophyllin, Podofilox for wart treatment, Tessalon for cough, Colchicine for gout, household products, Lindane, an anti-scabies medication, and all the blood thinners, anti-seizure, antiarrhythmics, or anti-specific asthma medication called Theophylline, all the opiates, and antipsychotics like haldol, geodon, and the anti-malarial medication. So Poison Control Center in 1950, a committee was formed by the American Academy of Pediatrics found that injuries resulting from unintentional poisoning were a significant cause of childhood morbidity and also mortality. So they determined that there was insufficient reliable information of the active ingredients of common household substances and few accepted methods for treating poison patients. So in response, the first poison control center was created in Chicago in 1953, designed to provide information to healthcare providers. The popularity and success of the Chicago PCC stimulated a movement that rapidly spread across the country. So in 1958, the American Association of Poison Control Centers was founded and now have 55 regional centers, which provide consistent staffing, training, public and professional education, data collection, and recommendations. The regional center utilize one database, the National Poison Database System, which serves as an important role in poison center and public health operations. Now, the other day I overheard that my wife, who is a veterinarian, she did use a veterinarian poison control. So they do have that access, and perhaps I can do another episode regarding toxic ingested products for animal, for all pet owners and animal lovers out there, where I will interview her. So the poison control are staffed 24/7, 365 days a year by trained and certified professional, assisted by information system. And they answer the hotline. The poison center staff who answer the hotline are specially trained in toxicology, which allows them to rapidly assess, triage, manage, and monitor individuals exposed to poisons. Poison control centers have 24-hour access to board-certified medical toxicologists to assist with difficult cases. And a simple call to the PCC can do several things. It can help you quickly decide whether a patient with a particular ingestion need any treatment or observation at all, or need to go to the ED, the emergency department. If it can initiate a monitoring function where people can be followed up at home by the poison control center staff. It will also contribute to toxical surveillance, helping to track emerging drugs of abuse, medication, adverse events, occupational exposure, and prescription errors. And it can save money. Every call to the PCC saves $175 in medical costs due to change in management that they are able to provide. So the national toll-free number of poisoning is 800-1222. Again, 800-222-1222. Hopefully you never have to use it, but you can easily Google this number, I'm sure. And don't forget the list, the medication that are dangerous, and feel free and to use them anytime. Hopefully everybody stays safe out there, and have a wonderful rest of the day. Thank you.